Hello, everyone. A very warm welcome to all of you to Nursing Next Live, your digital coaching Pathshala. I am Chitra Pandey, your session mentor under Plan UG Norset. I am today here to discuss a very important topic with all of you, and that's why I have kept this special session for today. And before reaching and jumping to the directly to the session, let me just remind you that we have introduced a very good plan for you, that is Plan UG Norset, and we are very much happy that we are getting some responses from the students, and we hope to get more responses from more students in the future in the upcoming live sessions. And let me tell you again that all the live sessions till 15th of February, whichever you will be seeing under NLUG channel, will be provided free to the students, and they can easily watch whenever they want. So let me just share this today's topic and what we are going to discuss today. So as you know that the topic, you must have seen the updates also. What I'm going to discuss today is, so the very important topic, as per the very important topic, that is cervical cancer. And I think being a woman and being a nurse, you must be aware that how this cervical cancer is becoming a cancer burden in India. And very much it is very much evident that the number of cancer cases has also increased, right? Okay. So let me just share my screen and we'll discuss the topic. So yeah, today we are going to talk about Cervical Cancer Awareness Month. Okay. So as you know that January is the Cervical Cancer Awareness Month. So today we are going to talk about cervical cancer and what are the, I'll provide you the outlines, what we are going to discuss. That is, what exactly cervical cancer, what are the causes, and how can we prevent cervical cancer basically in India or worldwide, and what all actions has been taken by the WHO or the various health organizations to reduce the incidence of cervical cancer globally. So what exactly cervical cancer? I hope everyone must be aware of what cervical cancer is. Okay, so let's see what exactly the cervical cancer is. So it is the fourth most common cancer occurring in women globally, with 90% of deaths occurring in low and middle income countries. Reduce the incidence of cervical cancer. Yes, in low and middle income countries. So जैसे ही सबको पता है कि ये बहुत ज्यादा सर्वाइकल कैंसर के केसेस बढ़ते जा रहे हैं, and in India, as the data says, it is becoming the second most cancer burden disease in India. So now let's see what all factors are influencing जिसकी वजह से these cases are increasing and prevention is not occurring, right? So I think when we were in our colleges, or when I used to be in my college days, I heard of this HPV vaccination for cervical cancer, right? At that time, many of us, and being healthcare professional also, we were not aware of exactly HPV vaccinations and how they can be, we can get the HPV vaccination, what is the appropriate age to get HPV vaccination, and how can we prevent ourselves from cervical cancer. But I think slowly and slowly, the government is also creating awareness programs, and globally also. That's why Cervical Cancer Awareness Month is being celebrated, so that people can be made aware of this condition, and we can prevent it by appropriate screening at appropriate time and appropriate treatment also. So now, what are the factors that influence these cervical cancer? So first is lack of access to national HPV vaccination. I hope you must be aware कि हमारे पास में HPV vaccination globally भी available है और national level पर भी India में available है. But people not aware, and also it is not accessible. अगर ये vaccination universal immunization program में appropriately include कर दिया जाए, then yes, people will be aware and it will be easily accessible to the entire population. Apart from that, cervical screening का time पर ना हो पाना and treatment services appropriately ना मिल पाना, these are also the factors that contributes to the occurrence or incidence of cervical cancer. Other factors are social and economic determinants. As you say कि socio-economic status किसी का अच्छा नहीं है, people who belong to low socio-economic status, they are not they don't have that much access to these vaccinations, or they are not much aware about cervical cancer or human papilloma virus. सो ये जो फैक्टर्स हैं ये बहुत ज्यादा इन्फ्लुएंस करते हैं सर्वाइकल कैंसर के इंसिडेंस को, एंड दीज आर द ओनली फैक्टर्स विच विल हेल्प अस टू प्रिवेंट सर्वाइकल कैंसर. अगर ये फैक्टर्स को हम प्रॉपरली मैनेज कर लें देन वी कैन प्रिवेंट इट्स अकरेंस. ओके, so when we say what are the causes of cervical cancer, you must be aware that the causative organism of cervical cancer is human papilloma virus, right? So human papilloma virus, it is a common sexually transmitted infection which can affect the skin, genital area, and throat. So this virus can cause various conditions. However, majorly it is responsible for causing cervical cancer. And when the person has persistent infection with HPV, then the person becomes or comes at a high risk of developing cervical cancer. So when we can't say that with one infection or twice the patient has got infected, HPV can cause cervical cancer. No, it has to be the persistent infection with HPV. Now, it occurs usually in the females who are sexually active, right? So HPV occurs in the females who, this cervical cancer occurs in the female who are sexually active. So it is very much clear that at one point of life, either any women, every woman, I guess, can or might have developed HPV virus, or HPV virus, they might have got infected with the HPV virus. But जरूरी नहीं है कि उनको सर्वाइकल कैंसर होगा. यूजुअली मेजॉरिटी ऑफ द टाइम्स जो हमारा इम्यून सिस्टम है ये इस वायरस को इजिली एक्सक्रीट आउट कर देता है, एंड हार्डली अ फ्यू पीपल गेट symptomatic or they have infection. But when the people or the females have persistent infection with HPV, then they come in the high risk group of getting cervical cancer. Now, based on now what exactly this HPV virus is, we should know about its strains or its type, right? So based on their association with the cervical cancer and the precursor lesions, HPV virus can also be classified into high risk group and low risk टाइप, हाई रिस्क टाइप एंड लो रिस्क एचपीवी टाइप्स. सो अब हमें पता होना चाहिए कि कौन से एचपीवी के जो टाइप्स हैं वो हाई रिस्क में आते हैं, कौन से लो रिस्क में आते हैं. सो लो रिस्क एचपीवी टाइप्स इंक्लूड टाइप 6, 11, 42, 43 and 44, and high risk HPV types include, as you can see on the screen also, type 16, 18, 31, 33, and n number of times till 70. So these are the so many HPV virus types which are responsible for causing multiple condition, but majorly the high risk HPV types 16 and 18, they are majorly responsible for causing cervical cancer. So these were the HPV strains we talked about. Now we should know what are the risk factors. सबसे पहले पता होना चाहिए इस बीमारी के रिस्क फैक्टर क्या है, सो दैट प्रिवेंशन में हमें इजीली हेल्प मिल सके. So when we talk about risk factors, first is grade of oncogenicity of the HPV type. As I said, oncogenicity मतलब कितना HPV type, कौन सा HPV type is the positive organism, whether it is the low risk one or it is the high risk one. So yes, it is a risk factor for developing cervical cancer. The immune status of the person. The people who are immunocompromised, the females who are immunocompromised, for example, have HIV infection, are more prone to get cervical cancer. Usually cervical cancer, it takes 15 to 20 years to develop and become symptomatic. You know, किसी भी normal human being में 15 से 20 साल लग जाएंगे किसी को cervical cancer होने में, depending on the risk factors or the etiology. But in people who are immunocompromised, it easily they can get infection within 5 to 10 years of age after exposure. Then apart from that, presence of other sexually transmitted infections. As I said, HIV and other genital warts, any other sexually transmitted infection can also pose or put the person or the female at risk for developing cervical cancer. Number of births, the female with large number of births are also a risk factor for that. And young age pregnancy, it means their first pregnancy was at a very young age, or they have used hormonal contraceptive, or there is history of smoking. So all these factors cumulatively can lead to cervical cancer or increases the risk of person getting infected or becoming or developing cervical cancer. Now we talked about what are the causes, what are the risk factors, how does it happens. The very important part which we need to play as a healthcare professional is prevention of cervical cancer. How we can prevent it, how we can make people aware about it. That is our role as a nurse, right? In community. So how we can prevent it? Very important, as I've already told you, we have available, readily available indigenous vaccination, that is for human papilloma vaccination, and between 9 to 14 years of age. Okay, that is the age group for which vaccination is effective, because it has to be given when the person is not sexually active. Before getting sexually active, the vaccination has to be administered. Then only the prevalence or the incidence of cervical cancer can be reduced, and it will be highly effective. Screening from the age of 30 years of age, screening should be started so that pre-cancerous lesions जो हैं उनको easily we can identify and treat at appropriate time so that वो cancer में develop ना हो. Okay, so screening is also important, and it usually starts from 25 to 30 years of age. Early detection followed by prompt quality treatment. Very important. It is a part of screening only, but yes, it depends whether the person has acquired the disease or not, but we have to detect it early so that prompt treatment and interventions can be taken. Very important part as a healthcare professional or a public health nurse, or may say nursing officer, our role is to make the people aware about cervical cancer and HPV vaccination and the incidences, risk factors, causes, everything. We have to make them access to the information and services so that they get well aware of the disease condition and take appropriate steps to prevent from it. Okay. As I can see, there are no certain questions about the condition. I'll move forward and we'll talk about why I have chosen this particular topic for today's session discussion is, as this is a January month, and we all know that Cervical Cancer Awareness Month is a January dedicated as a Cervical Cancer Awareness Month. So we'll be talking about this year's theme, 2024 Cervical Cancer Awareness Month January theme, and what are the agenda of the WHO, why they introduced this particular theme in this year. So let's see. This year's 2024, the Cervical Health Awareness Month theme is Learn, Prevent and Screen. Okay. It means you have to educate people, learn, prevent and screen. So this basically theme emphasizes the necessity of educating the people with knowledge about minimizing the cervical cancer risk and life-saving importance of regular screening. तो हमें लोगों को बताना है कि exactly हम कैसे सर्वाइकल कैंसर को मिनिमाइज कर सकते हैं, इसके अकरेंस को, और स्क्रीनिंग की इंपॉर्टेंस क्या है, रेगुलरली व्हाई दे हैव टू गेट देमसेल्फ स्क्रीन्ड और चेक्ड अप सो दैट इजीली हम सही टाइम पर सर्वाइकल कैंसर को डिटेक्ट कर सकें. सो दिस इज द थीम ऑफ आवर 2024 सर्वाइकल हेल्थ अवेयरनेस मंथ. लर्न, प्रिवेंट एंड स्क्रीन. Okay. Now, moving forward, we should know what exactly HPV vaccination is, how we can get it, where we can get it, what exactly the schedule is, and what vaccination is available at national level. Because WHO का जो schedule है, it has recommended, it has 6 types of vaccines which are readily available globally. But in India, we have specific strains which are available. I'll be discussing further. पर अभी हम बात करते हैं which of the vaccinations are available or recommended by WHO. Now, what exactly the WHO recommended schedule is? It recommends 1 or 2 doses schedule for girls between 9 to 14 years of age, 1 or 2 dose schedules for girls between girls and women from age 15 to 20 years of age, and 2 doses with a 6-month interval for women older than 21 years of age. So these are the 3 recommended schedule for HPV vaccination by WHO, जिसमें 9 to 14 years of age group को रखा गया है, जिसमें 1 और 2 डोज शेड्यूल रहेगा. 15 to 20 years of age group को रखा गया, जिसमें गर्ल्स भी आती है, women भी आती हैं, उसमें 1 और 2 डोज का शेड्यूल होगा. एंड ओवर द एज ऑफ 21 years age, 21 years, 2 डोज शेड्यूल रखा है, which will be given 6-month interval. Okay, within the 6-month interval apart. Now, India mein what vaccination do we have in hand or available? Okay, so globally we have 6 HPV vaccines available. That is 3 are bivalent, 2 are quadrivalent, and 1 is non-valent. So 3 bivalent, 2 quadrivalent, and 1 non-valent vaccines available globally. And all these vaccines are highly efficacious in preventing infections with virus type 16 and 18. As I told you, because high risk HPV virus type 16 and 18 are the most one responsible for the occurrence of cervical cancer. That's why the vaccinations are also formulated or developed considering these HPV types only. Now, as I said, globally हमारे पास 6 vaccines available हैं, but in India we have India launched its first locally produced version of human papilloma vaccine, virus vaccine, that is Cervivac, in 2022. So this is India's first indigenous vaccine available in market since 2023. So 2023 से हमारे पास में इंडिया की अपनी ही बनाई हुई वैक्सीन अवेलेबल है, दैट इज सर्वोवैक, विच इज फॉर ह्यूमन पैपिलोमा वायरस वैक्सीन to prevent from cervical cancer. Now, when we can get these vaccines, what exactly the schedule is that we should know. Exactly route क्या होता है, किस रूट से देते हैं, साइट क्या होती है वैक्सीनेशन की, कहाँ पर देते हैं, because sorry, when we study about immunization schedule, आपने normal national immunization schedule जब पढ़ा होगा, for every vaccine we have a certain dose, we have a certain route of administration, site of administration, right? So for that, in the same way for HPV vaccine Cervovac, we have schedule in India. So Cervovac schedule in India as follows. It has to be given intramuscularly in deltoid region. The age group are 9 to 14 years of age, which follows 2 dose schedules. That is 0.5 ml at 0 day. It means when the person is getting first dose of vaccination, and the second dose has to be after 6 months. And between 15 to 26 years of age, the schedule follows 3 dose schedule. That is 0.5 ml dose at 0 day, then on second and 6 months. Okay. So these are the schedule for HPV vaccination available in India, that is Cervovac schedule in India. Now, very important point or important part to be taken care of or to remember is, okay, here when we talk about, let me just highlight it. So when we talk about specific considerations for the vaccination, if you can see in this column, I have marked it as asterisk mark, the second dose, okay? The second dose should be administered. The second dose should be administered at least 1 month after the first dose. At least 1 month. तो first dose के at least 1 month बाद ही आपको second dose administer करना, not before that. And the third dose, as if we follow the 3 dose schedule, then the third dose should be administered at least 3 months after the second dose. So very important part है ना, समझे? हम समझ गए कि फर्स्ट डोज के बाद सेकेंड डोज के बीच में कम से कम 1 मंथ का गैप होना चाहिए, और थर्ड डोज और सेकेंड डोज के बीच में कम से कम 3 मंथ्स का गैप होना चाहिए. So this is supposed to be noted, and all these 3 doses, if you are following the 2 dose schedule or 3 dose schedules, has to be given within a period of 1 year. एक साल के अंदर अंदर आपको सारे ये schedule खत्म करने हैं. It should not be extended beyond that. Okay, so these are the schedules we have for HPV vaccination in India. I hope आपको समझ में आ रहा होगा, and you must be seeing कि क्या what all things we have advanced and what all vaccinations we have in India available for us, और जिसकी information knowledge we have to make people aware about it. Okay, now apart from Cervovac, what all vaccines are available in India? But Cervovac, because it is indigenously made in India only, इसलिए ज़्यादा follow होती है. So the type of vaccines available in India are Gardasil. As you can see here, the type of vaccine available in India is Gardasil. Let me just highlight it. Okay, so as you can see here, Gardasil, okay, that it is a quadrivalent vaccine. It targets 4 strains of HPV virus, that is HPV 6, 11, 16 and 18. आप देख रहे होंगे 16 and 18 हर वैक्सीन में अवेलेबल है ही है, because this is the most common types which are responsible for cervical cancer or which lead to cervical cancer. That's why हर वैक्सीन में ये वाले वायरस को स्ट्रेन को कवर कर ही रहे. Then Gardasil 9. Gardasil 9 is a non-valent vaccine, and it prevents infection with the 9 HPV types. So इसके ज़्यादा प्रिवेंशन के जो HPV टाइप ज़्यादा है इसमें कवर होते हैं, दैट इज 6, 11, 16, 18, एंड इट कंटेन्स अदर 5 high risk HPV types also, like 31, 33, 45, 52, and 58. And the Cervavac, as I've already told you, it is a quadrivalent vaccine and it targets 4 strains of human papilloma HPV vaccine, that is HPV 6, 11, 16, and 18. So the most common one used is Cervavac quadrivalent vaccine, available in India. Okay. Now, you know about what all things government is doing to prevent and make people aware about cervical cancer, make people aware about available HPV vaccination, the importance of screening कि time पर detection हो जाए तो हम cervical cancer को prevent कर सकते हैं होने से. But apart from that, WHO, what WHO is doing? So WHO response is WHO has set 3 targets to be achieved by the year 2030. Okay, 2030. To put all the countries on the pathway to elimination in the coming decades. Now, what are those 3 targets जो 2030 तक WHO aim कर रहा है achieve करने का? That is 90% of girls to be vaccinated with HPV vaccine by the age of 15 years. 70% of the women screened with a high quality test by the age of 35 and 45 years of age, and 90% of women with cervical disease receiving treatment. So these are the main 3 targets set by the WHO to be achieved by the year 2030. Okay. So that cervical cancer can be eliminated or its occurrence can be prevented. So this is the WHO response for cervical cancer. So I hope आपको एक बहुत ही brief और एक बहुत ही fruitful idea and information you must have received by this today's session, and that's why I am trying to come up with some more sessions. Like पिछली बार मैं एक antimicrobial resistance पे session लेकर आई थी and many students liked that session. So I am hoping कि मैं future में और भी session लेकर आऊँ which will be more informative for you and आपको और ज़्यादा information एक fruitful way में presented मिले. So I hope आप सबको ये session बहुत अच्छा लगा होगा, and you must have some takeaways from this session, and I wish you all the best for your studies and examinations. Study hard, prepare for your examinations properly, and do watch the videos and live sessions on NNL UG channel. Thank you so much.